Can you hear me clearly? Yes? Okay, good morning everyone. I'm Hsiao-Yean Chiu, you can call me Chiu or call me Shannon, and I'm from Taipei Medical University. I'm not sure have you ever been to Taiwan, but from the picture here, probably you can see the tower is the Taipei 101, and our campus quite near to the Taipei 101. And welcome, one day you can visit our school, our campus, okay? Yes, okay. My background is from the nursing department. So today I would like to talk about the topic as you can see here. So I would like to talk about the transforming nursing care, innovation through the technology-assisted intervention in ICU, because I used to be an ICU nurse. So now before my talks, I would like to know how many of you have worked in the ICU before? Can you raise your hand and let me see? Oh, no one. Thank you so much. So I'm not sure whether you are interested in this, but now you all know that for the nursing part, we all face the nursing shortage. So we have to find out something can help us to reduce our workload. And I believe the technology-assisted intervention probably can play an important role about that. So before we talk about the technology, we have to show you several situations that we might have for the ICU patients. The first one is the intensive care unit acquired weakness. I think if you are the PT, probably you heard this before. It's a kind of muscle weakness in this population. In ICU, especially for the patients who are using the mechanical ventilation, they might face the ICU AW half-full length. Can you imagine that? If they experience ICU AW, means patient might prolong the use of ventilation and also prolong their stay in the ICU, even the stay of the hospital, and then even increase their mortality. Other issues including like a psychological distress and sleep disturbance in ICU. As you can see, the numbers are showing here. Can you imagine that? Around 80% of patients they stay in ICU may experience anxiety and depression. And also, around 70% patients they have sleep disturbance in ICU. Means that they can sleep well, and also they face depression, anxiety. And you can see that because in ICU, patients have to stay in an isolated room, and they only can hear the voice from the medical staff. For example, like CPR. So the patient, they lie on the bed, they will think about, am I the next one? Right? So the psychological distress is quite large for those patients. So actually, according to Society of Critical Care Medicine, they published the practice guideline in 2018. Actually, they renew the guideline every 5 years, but so far, 2023, we haven't seen the updated one. So I show this one to you. We call it as the PADIS guideline for the American Society of Critical Care Medicine. They say that we have to focus on 5 issues in ICU patients, which are the pain, sedation, delirium, immobility, and sleep. So today I'm going to focus on the immobility and sleep to see that how the nurses will develop the technology assisted intervention to help our patients to increase their muscle power, decrease their psychological distress, and as well as improve their sleep quality and quantity. So this is what I just mentioned, that all the world we face a nursing shortage, and this is what I'm thinking. We can use different technology to improve the nursing care. So the study one, I would like to show you, actually this one has been published in Intensive and Critical Care Nursing with impact factor more than 5. And this study, we're trying to explore the effects of interactive hand grip games on psychological distress and hand grip strengths in those surgical ICU patients. And as you can see the picture here, this is the interface we designed. We call the grapefruit game to train our patients' muscle strengths. In this study, this is a RCT. We divided our patients, 70 patients, into 2 groups, and 35 in hand grip strength game, and another 35 just join the regular routine care. And the outcome measurement include the self-reported anxiety, depression, and stress. And also we use the hand grip to measure their muscle strength. This is the design, the device. Actually, we work with another professor from the University of Technology Taipei, and we developed this hand grip, device. It is interactive. Why we call it interactive, as you can see here? So first of all, we just trying to build up the interface first, and also then put the sensor into the device. So every time when patient play the device, and then we will detect their hand grip strength. And then we also set up the prescription section. So every time when patient they use the device, and we can detect their strength, and we use every time the baseline muscle strength as their prescription. So we will set up the prescription, and we will add on their muscle power strength every time when they before they play the game. So why we call it as the interactive hand grip game? That's because when patient play the game, and the game will show on the screen, and the patient can see the screen and know they've been successful, grab the fruit, and also can count how many numbers of food they get it. Okay, so it's going to have like a positive feedback from the game. So how patient can improve their psychological distress and also improve their muscle power. So as you can see that every patient is going to undergo the 20 to 30 minutes per section and twice a day. Usually our patient just stay in ICU for surgical patient, and they play this for like 3 days long. Okay, this is the picture we show that our ICU patient, and this is an elderly adult, and he just lie on the bed and play with the game. So, and here you can see the baseline data, and for the two groups, for the demographic data and also their disease characteristics, there's no difference between the groups, so it means that they are quite homogeneous. This is the treatment effects on the psychological distress and not sleep. Here I only put the distress, the depression, anxiety, and stress. At the pre-test, no difference between the groups, but after the treatment, you can see actually the patients who enrolled in the hand grip group can have lower depression, anxiety, and stress compared to the routine care. For the hand grip muscle strength, you can see that over the 3 days, because we implement the intervention twice a day. So we have like a day 1 in the daytime and evening time until the day 3. So you can see that over time, the patients, their right hand and left hand, their muscle strength improve over time. And here also show the number of food. As I mentioned that the patient can see the improvement about the number of fruit, they grab in the fruit. And so they can also see the improvement. So I believe all the positive feedback can stimulate patient, and also that the patient feel that they can do it. Okay, they can do it. Okay, that's the first study. So next, I would like to talk about how I use the VR combined with the sleep bundle in our ICU patients to improve their sleep quality and quantity. And as you can see that we use the goggle in the right top, and that one is the Oculus version 2. And here in the bottom, you can see there are different views from our VR. So actually the VR takes around, the program takes around like 30 minutes long. So when the patient put on the goggles, they can see the daytime, and they just image that they lie on island, and they can see the ocean, okay? And they also can see the blue sky. So somehow we, just let the patient pretend that they are in a, island, not in the ICU. So can isolate it, all the ICU environment. So as you can see that over time, and also we have like a voice to guide the patient to take relax, okay? And you can see that through the sunset, they will feel that, okay, feel sleepy, and to go to the nighttime, they even can see the, the star on the sky, and also, okay, they can heard the wind sound or the ocean sound to let the patient feel relaxed. So in this study, this is also a RCT, but however, we haven't finished it, it's still continue. And overall, in the end, we hope that we can include 108 patients into the RCT. So one group will be involved into the VR combined with the sleep bundle, and the other will be only put on the eye mask. Actually, this is based on the guideline of the PADIS. And then we are going to measure, of course we have other measurements, but here I just put the one, I think probably related to today's topic. So we also measure the self-report sleep quality, we call it RCSQ. Another one, we use the objective measurements, include like HRV and EEG to measure their sleep structure in the ICU. So in addition to the VR, we also implement the SLEEP, S-L-E-E-P, the bundle. SLEEP, S stands for the support clustering. It means that we're just trying to concentrate all our nursing care in the nighttime, not just interrupt our patient frequently. And the second, we're trying to reduce the light and also the noise during the night shift. And then we also use the VR to reduce patients' emotion distress. And another E is the eye mask use. Means that every patient they in the ICU, they will put on the eye mask. And for VR group, they will use the VR, okay, in addition. And then the last one is the pain control, pain management. Because I think in ICU, patients always experience pain. But I think nurses and the physician probably did not deal with the pain properly. So usually we will require our nurses to assess our patient's pain, use the CPOT, the scale, every shift. And then if the CPOT greater than 3 means you have to give the medications to control the pain. So use the VR combined with the sleep bundle. So we hope that we can help patients to improve their sleep quality and quantity. As you can see, this is our patient lie on the ICU beds and put on the goggles. So usually patients use this VR around like 9 to 10 before their bedtime. So as I mentioned earlier, they use like 30 minutes per time for 3 days. So let's see the results. Now, so we have like 80 patients, so 40 and 40 each. So as you can see, the baseline, no difference between the two groups so far. So means that probably our randomization process is quite successful. Okay, so they are quite homogeneous. And you can see that around like 20% of patients they use the ventilation, and the mean length of ICU stay is around like 5 to 6 days, and the Part 2 score is around like 5 to 6, 7 around. So it means it's not really severe patients. So now let's see the first EEG data. This is a pretest EEG data. So you see that actually sleep can be strategized into different phases. From stage 1 to 3 is the non-REM sleep, and then we have REM sleep percentage. So, and also we indicate the total sleep time, sleep onset latency. Sleep onset latency means that when you turn off the light and fall in sleep, the duration of the time we call the sleep latency. And then a wake up sleep onset means you wake up during your sleep. Okay? And last one is the sleep efficiency. Actually, sleep efficiency is calculated by you use the total sleep time divided by the recording time, which is the time on your bed. So we measure those data and to see the baseline at the two groups, and we found that they are quite the same, means no difference between the two groups. Let's see the post-test for the EEG. Because now you can see the number is not 40, it's 27 and 28, means we haven't analyzed all the data. But as you can see that only the stage 2 are significant between the two groups. So means that VR has less stage 2, than ice mask, Although other variables are not significant, but we still can see the trend. I believe in the end, if we have sufficient data, probably we can see the significant difference. So actually, to the end, we hope that we can improve patient deep sleep. So means we hope that we can increase their stage 3 and REM sleep. And you can see that, yes, we did see the trend. So we reduce the light sleep, which means they are involved in stage 1 and 2. But we can see the improve the stage 3 and REM means they can improve their deep sleep. And we also can see that they improve their total sleep time, although it's still very, less. Means patient only slept 4.76 hours, okay, per day. So, and you can see that we also reduce their sleep onset latency, shorten their sleep latency, and then improve their sleep efficiency, although it's still poor. It's only 45.98, because usually for normal healthy people like you and me, so actually sleep efficiency must over 85%. So this is, that one is for the objective sleep quantitative data, and this is for the subjective sleep quality data. And at the baseline, using RCSQ, no difference between the two groups, but in the end, you can see after 3 days, the patients who are in the VR group feel better and feel they got the good sleep, okay, after they use the VR and combine with the sleep bundle, compared to the patient only use the eye mask and other sleep bundle care. And of course, we have to, interpret what is the mechanism can cause the VR's, the effects. So now we look at their HRV data. Here we only report the frequency domains data. And as you can see that in day 1, day 2, and day 3 in VR group. And in day 2 and day 3, obviously we can see that after they use the VR pre and post, actually their low-high ratio, low frequency and high frequency ratio decrease and significantly. So low frequency ratio represent the sympathetic activity. So it means that after they use the VR and they feel relaxed, can reduce the sympathetic activity, right? So now you can also see the ratio decrease below 1. So I think probably we can partially use the HRV results to interpret that, yes, I think probably use the VR can help us, our patient, to reduce the anxiety or kind of like a sympathetic activity and also improve their sleep quality. But now the study is still going. So the last slide is the key takeaway, is the technical message. So technology-assisted intervention can reduce the psychological distress, boost muscle strength, enhance both quality and quantity of sleep in ICU patients. And the last one is the digital health technology may transform the future of nursing care and provide an avenue for to reduce the workload in the face of a worldwide nursing shortage. Thank you so much. It's all my presentation. Yeah.
Thank you very much.